Hi, I'm Melissa Smith.
I'm Spencer Ziegler, and welcome to Data Lit, podcast for educators by educators. And we're excited to launch our second Research in Action episode today. So yeah, as a reminder, these arose from some of our conversations with Superintendent Taylor about just how do we kind of elevate the illuminating research that some of our practitioners might be doing. So throughout the series, which we space throughout the seasons, we'll chat with educators that are doing some fascinating research. And today we're thrilled to be joined by Tambryme Hamilton-Simmons. Tam, can you tell our listeners a little bit about yourself?
Absolutely. So, like you said, I'm Dr. Tambryme Hamilton-Simmons. I am currently a senior administrator for counseling, more specifically for elementary, and I work in CAS.
Oh, and can you remind us what CAS stands for? We have a lot of acronyms in Wake County.
Counseling and Student Services.
Perfect. Thank you.
So Tam, tell us about the topic for your research.
Well, I'll start with the title. It was the impact of social-emotional learning practices, specifically restorative practices and the community resiliency model on student behavior. And so the purpose of that study was to investigate the impact of implementing social and emotional learning practices. I chose restorative practices and the community resiliency model just because I'm most familiar with that, to see if they have an impact, whether negatively or positively, on the behavior of elementary school students.
Can you tell us around the time when you were doing this? Was this during the pandemic? I know there's been a lot of talk about social emotional learning. So was this?
This was during the pandemic.
Okay. Okay. So it seemed really apt.
2021.
Yeah, that seems like it's a perfect time to conduct that research, but also a very challenging time to logistically conduct that research.
Oh, absolutely. Logistically, so I was supposed to have 8 elementary schools participate in the study. Because of the pandemic and everything that was going on, 6 elementary schools agreed to participate in the study. However, another, pandemic barrier, only 2 elementary schools fully participated. And when I mean fully participated, the teachers took the surveys and the principals disseminated the surveys.
Okay.
That's probably a useful note that pretty much always when I'm talking to people that conduct research, it never quite goes as planned, and to probably budget that into the planning, and particularly with the pandemic.
And I think too, sometimes when we think of action research, you're like, oh yeah, I'm going to go out, I'm going to get these schools. But I mean, schools are doing all the school things.
Right.
Yeah.
Right.
So it's difficult sometimes to study the things that we want to study because of the nature of the vibrancy and all that's happening.
That's true. So what led you to want to focus on this in particular when you were deciding what you wanted to research?
So I was previously, before becoming a senior administrator, a school counselor. So in being a school counselor, I was trained in social emotional learning. And then I also took training specifically for restorative practices and the community resiliency model. And when I was teaching these practices in my particular elementary school, we saw how it impacted behavior positively, meaning when these practices were implementing, behavior of students went down. There were less office referrals, there were less suspensions. So I wanted to see if that was just my school and a trick that I could do, or was it every school or the schools that implemented these programs.
And I think that's timely because I think during the pandemic, we were probably ending our last strategic plan, but also gearing up for the new strategic plan. And I believe that is one of our priorities of the strategic plan, right? To kind of have us focus on not only student wellness, but staff wellness. So I think, it is timely to kind of look to see, if this is a priority of ours, how do we make this happen? So,
yeah. And I like that approach of something that you kind of have a hunch about, or something that you have kind of some anecdotal evidence, and thinking about like, okay, how can I conduct some research so that I can kind of figure out with a little more clarity what's going on here to share that. And that's something that I hope we can do with the series, if people are listening and, contact us, and we can help you to figure out how to research some of the stuff that you have hunches about.
Yeah, because I think best practices starts with one person practicing it, right? And trying to figure out, there seems to be something unique happening here. And then let's see what happens. That's how a best practice kind of becomes a best practice.
It should, but I feel like sometimes research comes from the top down, not bottom up. These people that aren't in schools that aren't doing that daily work. So hopefully, we can get more best practices from the practitioners themselves.
So what were the results? What did you find out?
So
was it just you?
Yeah.
The data would suggest it was just me. However, this is strictly because of the pandemic and the surveys that were disseminated were only in 2 schools. But those 2 schools the teachers that did implement the SEL practices, office discipline referrals, did decrease.
Okay.
The thing is, that's too low of a sample to say, oh, absolutely, this did work. So that was a huge limitation and barrier because we couldn't get, well, when I say we, me, I couldn't get into those schools. I couldn't get into those schools to see if these practices were working.
All right, this is Spencer cutting in for a second because I think Dr. Hamilton-Simmons actually brought up something really important. What happens when research doesn't quite go as you plan?
Yes.
Yeah, so we're going to do an actual an interview within an interview, kind of like Inception-esque.
Yep.
To kind of break this apart because it wasn't something that we talked about originally with Dr. Hamilton-Simmons. So for Dr. Hamilton-Simmons, that was, pandemic disrupted her sample size, but there's all sorts of things that can kind of change your original plans with research, right?
Yes. As my mom said, you always need to have a plan B.
Yes. So to kind of help figure out what those plan Bs might be, we're thrilled to be joined by Dr. Meghan Scrimgeour from our program accountability team. Meghan, thank you for joining us.
Welcome.
Thank you for having me.
So Meghan, can you tell us just how is program accountability involved with research?
Of course. I would say there are 2 primary levels in which we are involved in research. The first is my team and I do conduct program evaluations within the district. So we are looking at the effectiveness of our programs that affect staff or students. So we are very much involved in the research process there. Second of which, we are trainers, we're supporters, and we do assist staff who are interested and are conducting research themselves and need partners in this work. So we come in as thought partners and critical friends, exactly, to help them with this process and lend our expertise.
Okay, so that critical friend, I think that's useful framing. So how can you be, say, a critical friend to our listeners that might be thinking about research for when it doesn't go as planned? Come up with, as Mellisa said, that plan B. What are some strategies?
Well, first and foremost, let yourself know barriers are going to come up. It's part of research. We are not conducting research within a vacuum. So challenges do come. So it's not just you. Assure yourself that way. So from the perspective of DRA's program accountability team, there are strategies I would love to share that we have found effective in the past.
Yeah.
I'm sure many of your listeners are familiar with some of these strategies, but they are valuable and would love to go over them just to review and have in there.
Because they probably know them, but just haven't thought about them in this way.
Exactly.
Yeah.
Exactly. And this is by no means an exhaustive list of strategies either. You could probably do an entire series on those. But today, let me just highlight 3 strategies that folks could implement.
Okay.
First off, collaborate with school staff. So this actually probably isn't a plan B. This is your plan A. So anticipate, engage with school leadership. Whether you're conducting student focus groups, staff interviews, or administering surveys, it's critical that you have the principal's support.
Yeah.
As well as the admin support. So their support ensures a smoother access to their school, to the staff, to the students, and it helps you align your research goals with the school's needs. So having the principal and admin support is crucial for your implementation.
Yep. I can see why I would reverse it. I'd get excited about a plan and I'd do all this work and then later be like, okay, let me run it by this person. But getting the people on board first and making sure you have that locked in. Yeah.
And I think sometimes when we're doing action research, like I might have a teacher friend that I know who's my contact.
Right.
And then I'm like, oh, so excited. And it's like, this teacher, she's really super excited to try these things in her classroom and might forget to make sure I run it past the administration just so that they know and are aware.
Right, of what's going on in their school.
Yes.
Exactly. They're the gatekeepers to the school, so you want to make sure they're on board
Right.
and excited about what you're bringing to the school.
Sure.
Yeah, good advice.
But similarly, my second point here was teacher involvement
Okay.
as well. Yeah,
Okay,
so
yeah.
you don't want to leave out the teachers either, because they can be champions of your work as well. They can
Right.
help get you consent for the students involved.
All right.
Yeah.
And they can also help you identify some pitfalls too. If you're planning early enough to get their input on your research design, they could help you point out how it's best going to work in their classrooms. So for example, our program accountability team administering surveys often before actually doing the research study have gathered a group of teachers or whoever your participants are to review a survey
Oh,
Oh,
okay.
before
okay.
administering it.
Yeah,
So
yeah.
they can say, oh, questions 1 and 2 are great, but question 3, I don't know what that means. That's not
Right,
relevant
right,
to
right.
us. So they can
Yeah.
help give you that feedback and avoid those pitfalls later on.
And I'm sure they feel valued in the process.
Exactly. Yes, you definitely want their voice.
Yeah.
Yeah.
Exactly. All right. Second strategy is to offer flexible scheduling and formats. So coordinate with the school's schedules. You want to, again, be communicating with the principals because they are great at identifying good times to come into the school
Right,
for data
right, right.
collection, and then alternatively, less great times to come in because you want to avoid teacher work days, vacation days, other events that they have going on that you might not be aware of not being a school member. So they can help usher you into the schools at the appropriate time.
Yeah.
That's good. That's good. Yeah.
Yeah, so always be mindful about the school's schedule.
I like that piece. Be willing to be flexible.
Exactly. And an extension of that, when scheduling, be accommodating to their schedule. So, for example, if they recommend a focus group 8 a.m. Wednesday, but that doesn't quite work for your schedule, make it work. If you're
Yeah,
lucky
yeah,
enough to
yeah.
have coworkers that could step in and help you with that data collection, go ahead and do it.
Yeah.
Because they are doing us the favor to participate. So do them the favor of be accommodating to their schedules.
Yeah, that's important. And I suppose build that into your planning, some wiggle room in case things happen. Because, I think it's easy to forget that our office, I can control my schedule a little bit more than someone at a school can.
Yeah.
There's a lot of other people in that building, students and staff, and things can change and take priority. So building in that wiggle room so that if something does change because there's a fire drill or some assessment or whatever it might be,
Yeah.
that you're not like, oh no, I need to get this in tomorrow.
Right, yeah. Oh, that's a great idea or perspective that you're one person, but they are a classroom, a whole school,
Right.
whatever
Yeah.
your participant pool may be.
Yeah.
And then related, if your participants are parents, take that into consideration with scheduling as well. Parents have work schedules they're having to accommodate. So offer evening sessions, weekend sessions we've even done. And then offer flexible formats too. So to overcome these geographic, transportation, or scheduling barriers, offer online surveys if you're
Right.
implementing surveys.
Virtual
I was
meetings.
going to say, we live in a Zoom, Google Meet world now, so have those interviews over a virtual format if you can. Just make sure those formats are accessible and user-friendly.
Yeah.
Yep. Okay, what else are you thinking? These are all great. Thank you.
Last one I would recommend for today, number 3, is send reminders.
Oh, yeah.
We are very busy people, especially schools, teachers, staff have a lot on their plates, and research is not their top priority. It's the last thing that they are thinking about on their
Yeah.
list of to-do items. So don't be obnoxious about it, but send those reminders of upcoming dates or deadlines for surveys when you're coming in for the focus groups. Just friendly reminders of what's coming up so that they're not having to hold that in their heads.
Yeah.
And that can help increase your response rates as
Yeah.
well.
That's good. Yeah, I feel like there's that thread going through of just making it easy and accessible for the participants in the study. And then that flexibility on your end. Yeah, I think that's useful.
Exactly. Yeah, you want to lessen the burden on participants, so the less they
Yeah.
have to worry about, the better.
Yeah. Now, none of that would have necessarily helped Dr. Hamilton-Simmons too much because a global pandemic is a big and uncontrolled variable. But hopefully our listeners tuning in that are thinking about research, I think those are some great strategies to use.
So when you are working with either qualitative or quantitative data and you don't get the amount of data that you anticipated.
Yeah, like the sample size with Dr.
Yeah. How do you move forward?
On the front end of that, to try and overcome that from the beginning, you always want to oversample. So for a focus group, ideally you want between 5 and 8 participants.
Okay.
If you only invite 5 to 8 participants, you're not going to get that number. People won't show up day. They're going to be sick. They don't want to participate,
So pad ahead of time.
pad ahead of time and invite 15. And then maybe you'll get the 10. Surveys, same thing. You have your certain sample size you want, pad it over sample to try and overcome that.
Oh, that's a good one. Yeah, I like that.
Yeah.
So is it ever a case where you throw out the data, or how do you talk about the data afterwards? Do you always have to put like a qualifier? Oh, this was based on...
Yeah. Let me see if this is answering your question. But yes, when you are writing up your results in your methodology, you always provide those details.
Okay.
How many participants you had, how many surveys were filled out, et cetera.
Okay.
It's just that can become a limitation. So if, for example, like you were asking, if you don't get the amount of participants you really needed, that goes in your limitation section. That goes in your discussion section to say, this is how many participants we had. It was underpowered. Moving forward, this is what we can draw from the data. Right.
But the results, making sure that you are clear that the results that you found were based only on this number.
Yeah, be upfront, be very clear about what the methodology was, how much data you actually were able to collect.
Okay. And that, I think, goes to just the certainty of the conclusions you might make from it. And that probably gives us a good segue back to interview number 1, going back up a level in section style. Because next we hear from Dr. Hamilton-Simmons talking about her own kind of personal reflection and what she got out of the process of researching social emotional learning. Let's go back to the original interview. Thank you, Meghan.
Thank you for having me.
Yeah, so encouraging, but not necessarily conclusive yet. And hopefully more people can start to research and kind of tell you.
And I think more people are, just from me going back on my research and looking not necessarily in Wake County, but other counties who are implementing social emotional learning practices, not just restorative practices in the community resiliency model. They are seeing that it is impacting student well-being, whether that be students going to their school counselors or their, being more open, things like that.
Yeah, and that makes sense, right? And like, social emotional learning is nothing new, but I think there's an increased emphasis on doing it systematically and intentionally and collecting data about what's working. But that basic idea behind it, no matter what the program might be, makes sense. Yeah, kids are humans. And when you tap into that and respect them as that, it's going to have results, I would imagine. All right, so then how would you say that this research project that you conducted, how has it impacted your professional growth?
So when digging into more of the social emotional learning practices, I realized that social emotional learning can have a color blind, meaning one size fits all. And we can't really do one size fits all. So we have to be very intentional about which practices that we choose and why we're choosing it for that particular school or even that particular classroom, that particular student. Because as we know, one size doesn't fit all. And sometimes with social emotional learning, it's like everybody can do this. Everybody learns this way when that's not necessarily the case. So what I've learned is when we give people the tools to know that some kids are like being trauma informed, being more cognizant that people are different and that's okay. So they're not going to learn exactly the same way. And having those skills necessarily to learn or to teach how those particular students.
It makes me think that then as an educator, I need to have several strategies, I guess, available to me. If it's not a one size fit all,
Absolutely.
Then I have to have several strategies available to me to be able to sort of tap in to know which strategy works best, right? If it's not a one size fit all.
Absolutely. So currently our district is using Second Step and it's great. It's a great program. Yeah. However, if you're not culturally sensitive or you're not trauma informed, you might take the approach of, I'm going to read the script. And if I read the script, it's going to fix everything in my classroom. Well, it may not because everybody is different.
Right. So there's some assumptions I think you have to be aware of, I guess.
Absolutely.
Yeah, that makes sense. It makes me think of some of the conversations in DRA. We have a program accountability team, and they've kind of stressed over the years that there is no turnkey solution for anything.
Yeah.
As we've been looking at curriculum implementation, any implementation science. I think that's got to be particularly so with social emotional learning.
Yeah.
Also, it's just deepened my understanding of what it was. It's not social emotional learning. It's not a program. It's just being able to teach the 5 components of social emotional learning, which are self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. So it's not just a program. It's something that, like skills, things that you implement into the classroom every day, whether that be with relationship building. I'm going to stand at my door and say hello to everyone and do like a temperature check. That's social emotional learning. It's not just a program.
I like that. It's both simpler and yet more complex than you might think of. It's just, we bought this thing, now we're doing this thing.
Right.
I think I like the idea too that if my school did not buy a program, I don't have to feel helpless as an educator that I can't do anything, right?
Right.
When you think of these 5 competency areas, there are little things that I can be doing to be working towards increasing kids, I guess, competency in those areas or their social emotional learning in those areas. There are little things that I can do, which feels more hopeful, I guess.
Yeah. Yeah. And hopefully as we see more and more research about the value of doing these things, no matter what the proper noun is, that encourages teachers to invest the time, because time is the scarcest resource in education. So it might be tempting to be like, but I got these next 4 things on the lesson plan, but remembering that those CASEL competencies matter just as much, if not more so, because if a kid does not feel comfortable and welcomed, then their amygdala is going to get tripped, and then none of the curriculum is going to really matter.
Right.
Absolutely. Yeah. So that's where we bring in the Maslow's before we bloom.
Yes, I remember that.
Well put. All right. Well, thank you, Dr. Hamilton-Simmons. This was wonderful to hear about your research.
Thank you for having me.
Also, thank you to Ligon Middle School's Alex Scott for the wonderful theme song. And also, you can learn more about these topics at our website, www.wcpss.net/datalit. And we'll catch you next time.
Bye.
Bye.